Thank you very much. My name is Lamin. So Gambians sometimes find it very difficult to access healthcare service in this country. Now a new company, Innovarx Global Health, has come to help you in your healthcare needs. But how does it work? Well, I'm joined by Dr. Ismail Badjie. He's the Chief Executive Officer and founder of this company. Dr. Badjie, thank you for speaking to us.
Thank you. It's a pleasure having you guys. Welcome to Innovarx. So definitely you guys are welcome.
Thank you. So first of all, take us through your company.
Yeah, so Innovarx Global Health is a healthcare solutions company. So we build it as an access equalizer, meaning we looked at the Gambian health ecosystem and saw how we could fill the gaps in access. So that could be from quality medications to diagnostic capability to distribution models to pharmacy services. And then out of that need, we built a company to kind of fill the gaps, to make sure people now have access. Obviously, it's a U.S. company, so we're operating in the U.S. as well, too. So that gave us an advantage now to export excellence in terms of healthcare delivery and create a model that now Gambian people could benefit from.
So how or when did it all start, this issue of you doing some research in terms of pinpointing the gaps and coming up with something?
Yeah, so I've spent half of my life in the U.S., but I also spent a significant amount of time in the Gambia. So I've lived here growing up. So the company, I started the company in 2015. So 2015 is when we started traveling to Gambia, looking to establish this organization. So it took us 5 years, but that also gave us opportunity to see what's working in the system, see what gaps they are. And through that market research, studying the needs of patients, understanding the relationship between Gambians who don't live in the Gambia, who have Gambians who live in the Gambia who need healthcare services, also studying how much of Gambian people are going to like Senegal for certain treatments, certain diagnostic capability. So that's how we literally formed the company. So since 2015 till now is how we've been operating under.
So were those some of the things that intrigued you the most when you were doing that groundwork, that research, in terms of knowing what exactly Gambians need when it comes to healthcare?
Absolutely, and I think I was practicing also in the U.S. So I practice as a community. I'm trained as a doctor of pharmacy, so I worked in the communities in the U.S. So that gave me an idea of what a health system should look like. It gave me an idea of what pharmacy services should look like. It gave me an idea of what quality looks like in terms of products and services. So that definitely added. So the fact that I was practicing in the US, but also still very involved in the Gambian ecosystem, that's how the ideas came to be. That's when we realized that, okay, we need an electronic health record system, AGASTA, that could give people access to their records electronically. That's when we saw a need to bring out over-the-counter products of quality for patients. So that was definitely part of the process.
And so how do you go about it, in terms of helping people in their healthcare?
So part of it is just providing services. So one of the key areas that we focus on are non-communicable diseases, meaning diabetes, hypertension, high cholesterol. So diseases that sitting next to you doesn't mean I'll give you the disease. But if we look at how diseases are managed, access to quality medication is really, really important. Being properly diagnosed and monitored after the diagnosis happens is extremely important. So that's how our services almost complement each other. So a Gambian patient now who normally would have to go to Dakar or overseas because they have hypertension or diabetes that's not managed, you could come to our facility, we could make sure we do the diagnostic test that's required, involve a general physician, a doctor to oversee the diagnosis, make sure it's accurate. But what happens after the diagnosis, you need quality medications. You need to be checked on a regular basis. So the company is now in the position to offer those solutions.
Those solutions too, not just stopping at the diagnosis, but also
exactly the continuity of care.
Treatment and then
exactly. So even elements to our company like Wellness on Wheels, for example, is designed also to include people that don't have to come into the facility. So every single clinical service that we offer, we could go to somebody's bedside, we could go to somebody's office and make sure the medications are delivered. So it takes into account Gambians in the Comba area, But even all the way to Basse, Mansa Konko, Kerewan, they still have access to these services, which is why being an access equalizer is one way of describing what we are.
So in a country where, there are various challenges, problems when it comes to healthcare, people's level of, awareness, and even education is very low in terms of accessing these services. How are you managing that?
We're managing it by managing expectations. Because I feel like even though our company is extremely innovative, because we're using technology in a way that even some advanced countries are not using it with telemedicine, with point-of-care testing. So we're managing expectations, meaning that, yes, these problems exist, but as a company, we see these problems as opportunities to find solutions that not only fix a problem today, but could sustain a good system over 10 years now, 20 years from now. So we manage expectations and we explore how could we bring along the government, how do we bring along the private sector to build now systems in place that we may not see the benefit of it today, but if we're managing diabetes better, if we're managing hypertension better, maybe 10 years from now, 20 years from now, we've created a Gambia where every Gambia has an electronic health record using Agasta, where there's a unique medical record number. Less Gambians are dying from hypertension, less Gambians are dying from diabetes. So the benefits, it's very long term, which as a company, we know we're not looking for quick wins. We can't be attracted to instant gratification, but we could see every single problem in the system, identify who the stakeholders are, who do we need to collaborate with, and start implementing programs that could be sustained by ourselves. So there's a huge emphasis on building capacity of Gambian healthcare professionals too, where now our nurses, our doctors, our pharmacists are not only using electronic health record systems, but they're abiding by good practices within their own field. So it's definitely going to be a long journey, which is why we're committed to make that change.
And there is also this issue of people not having the means when it comes to taking care of themselves, health-wise. Poverty is prevalent. The greater number of the Gambian population is poor, and sometimes when they have certain illnesses, they find it very difficult to even get treatment. Yeah. Are you aware of this?
I am, and I think that's what influenced our corporate social responsibility. So when we launched the company, we launched a program called What's Your Number? So What's Your Number was our promise to the Gambia. So we built a system now where every single Gambian, be it from here all over the country, you always get your blood pressure checked without paying a fee. You always check your blood sugar checked without paying a fee. So we plan on actually screening as many people as possible for diabetes and hypertension at no cost. So now at least we're alleviating one of the biggest factors, which is cost, and the program is on the road. So we're going into these communities to also take the barriers of access and transportation, all because we know that yes, it costs money to the company, but affordability has to be at the cornerstone on every single effort that we do. Yes. And eventually we could help find subsidy programs as well too, where now we could subsidize certain medications for hypertension, we could subsidize certain medications for diabetes. So I think that's where even organizations could come into play. So if we identify, let's say, Birkama, 20% of Birkama is pre-diabetic, then maybe if there's funding available, it could go to those subsidy areas. So it's at the key of our corporate social responsibility, and we're proud to say that now, before Gambians had to pay to check their blood pressure checked, Gambians had to pay to get a blood sugar tested. And now with our company, we're offering it at no cost. So it's not big, but it's at least a step in the right direction. It is.
We will go with this up close, and then we will be right back. So this is Innovarx Global Health. This is their offices here on Fatima Golden Globe, here around the IEC. So I am with Dr. Ismail Badjie. He's the founder and chief executive officer of this company.
Welcome. As you can see, we'll probably start here just to kind of show you our delivery system.
Yes.
Which is the Wellness on Wheels.
Wellness on Wheels, okay.
So that's designed to deliver products and services anywhere in the Gambia.
Okay.
Those are the ones we're going to deploy up country as well too. So as we go through the wellness store,
okay.
All the wellness products after you.
Yeah, thank you.
All the wellness products will be there.
Yes.
So yeah, so this is the wellness store. As you could see, we designed it very similar. Some people tell us like it looks like a Walgreens or a CVS or a Boots,
yes.
But that's by design.
Yes.
What we did was we broke it down into sections.
Yes.
As you can see, all the children's medication, all the infants' medication
yes.
are here.
Yes.
And the beauty of it is we always have a pharmacist available.
Yes.
So in terms of product selection, making sure these products are safe and effective, we also always have healthcare professionals that could come out and help customers choose the right product.
Okay.
Right?
Okay.
This is something I'm very proud of. This is our For Gambia by Gambians.
Okay.
So I believe we have such talented Gambian entrepreneurs who are doing a really good job, not only manufacturing, but packaging wellness products. So from our natural tea, Bormor to our Nopal Jack, who they make chura gelte, groundnut cake.
Yeah. So one can simply just walk in and then grab.
Absolutely.
Yeah.
Absolutely. To even facial creams like Ansubis, Maimunas, Moringa, and, Annie's Honey. So all of these are local Gambian entrepreneurs who are really in this space. So that's the one thing that we don't get from the U.S. That's from the best of our very own Gambians. Right?
Okay.
So moving on as well to same thing categories, we have men's health.
Yes. So, men's health.
Yeah. So
Section,
yeah.
Okay.
So men's products from their personal care stuff, creams, facial washes, deodorants, a lot of hygiene stuff. As here as well, we have
health and wellness.
Health and wellness, so cough and cold.
Yes.
So from cold medicine, allergy medications, vitamin C. So it's easy. So if you have one symptom, you don't have to go to multiple places in the store. If you have a cold, you just come to the cold section, and then the team comes to you, and a wellness consultant helps you based on your symptoms as well too. So a lot of these products, there's no need to keep it back there. It has to be easily accessible as well too. Some products as well too that we wanted to feature are like smoking cessation stuff. So people who want to quit smoking, that want to use a nicotine patch is one of the things. Our pharmacists are trained to counsel people on how to quit smoking.
Yes.
So we have some items like diabetic socks,
yes.
compression socks as well too. Here we have all our stomach medication.
Yeah.
So from heartburn to anti-gas to laxatives to people who struggle with constipation. Also one section where all matters GI is here.
You can find, okay.
And this is our pain and first aid aisle. So once again, you'll notice we, obviously, like I mentioned earlier, all of them are U.S. products. So we have Tylenol, we have ibuprofen, Excedrin, right? Some antibiotic ointments, some burn cream stuff. So a lot of products that are here. Both tablet form, liquid form. But once again, I emphasize the importance of having healthcare professionals that
help you.
Exactly, that could meet you and tell you, okay, the right dose for this, the right dose for that. Right? Here we have nutritional stuff, so protein, meal replacements, and the like. And then vitamins. Yeah. So we have almost every single vitamin that you could want, from vitamin A, B, C, D
to Z,
all the way to zinc. Prenatal vitamins for women who might be pregnant. Joint supplements, multivitamins for adults, cod liver oil, calcium, just you name it. But also having a pharmacist and a healthcare professional makes it easy to select the right product.
So that's the wellness store.
Yeah, this is the wellness store.
All these products you bring them from the United States.
From the U.S. So Quality Choice is our brand. So Quality Choice is the brand that we have on the market. So all our products, you'll notice it has QC. QC is our U.S. brand that we're introducing. So Gambia is the first market in Africa for QC to be here. So that's something we're proud of because it's something that Gambian people have access to. Yeah.
So and then this I see the pharmacy.
It's the pharmacy area. The pharmacy area.
Staff only. I hope they will allow us.
We'll make an exception for today. We'll make an exception for today. So we built it.
Good afternoon.
So we have Allison, pharmacy intern, and then Fat Cisse, who's a pharmacy technician.
Nice meeting you.
So we basically imported a U.S. pharmacy and brought it to the Gambia.
Yes.
So from technology to labeling. So every single product leaves this way, which I think is important. It has the patient name, how to take the medication, which doctor wrote it, how many did they write in liquid form.
Liquid form too.
Right. If it's kids' medications, we make sure we provide them with syringes.
Syringes, yes.
Right? Because I think measuring the right dose is really
very,
important.
Very important, yeah.
So if a child weighs a certain amount and they have to take 4 milliliters, instead of using a spoon at home, we'll give you the right thing to measure it with.
To measure it with.
Yeah, so this is the pharmacy area. We're still waiting on our prescriptions to get here from the U.S.
From the U.S.? Okay.
But it also runs on the electronic health record system
okay.
as well, too.
Impressive.
So this room, we have our consultation room for private conversations.
Yes.
But we also have our telemedicine room.
Yes.
So our telemedicine room is designed for doctors to communicate with doctors in another country, for patients, let's say, could be here and have a consultation with a specialist in another country. So we've had patients who need spine issues or need to speak to a nephrologist. We do their kidney function tests. They do a video conferencing with a nephrologist in another country. So a lot of cases that they had to travel to go do, now they could just come in and have access to the world. So this is IGH's gateway to the world.
Yeah.
Right?
Impressive.
So here,
this is a
point of care testing, yes.
Testing room.
So I tell people the difference between a lab and a point of care testing center is point of care is designed thinking about portability, efficiency. So all our equipment are stuff we could pick up and go to somebody's house and do a test. So for example, this machine, we use it to do our cholesterol test. We get results within minutes.
This one, is it hemoglobin?
The hemoglobin, exactly. Okay. The HemoQ, really, really portable. We could take it, go to somebody's house and get it done.
And get it done there.
Especially with pregnant women, where this is such important in making sure the hemoglobin is at the right place before they give birth.
So your test, how long do they last?
Minutes. But glucose and these, we test all our biochemistries with. So our kidney function test, our liver function test, and that's the longest time it takes to do a test, and it's 12 minutes.
12 minutes, okay.
Our longest time we take.
That's the longest.
That's the longest. We have
not bad at all.
No, it's really, really fast, and all of them are integrated into Agasta. So
the Agasta.
Yes, system. Agasta is our electronic health record system that's cloud-based. So it's real time. So even with a doctor being next door, the moment Karel puts the results in, she sees it. So now clinically, she has all the information she needs to make the right diagnostics, diagnosis, to prescribe the right medication, and she could electronically send it directly to our pharmacy, and they process it. So all of that could happen within minutes. For processes that used to take hours or days. Sometimes as well too.
Now it will be a matter of minutes.
Exactly.
Thank you very much. The interview with Dr. Ismail Badjie, Chief Executive Officer of Innovarx Global Health, continues. So now, Dr. Badjie, we want you to talk to us about the medical providers, health care providers in this country. How are you working with them? How is your relationship like with them?
Positive. I think one of the things we were intentional about from day one is realizing that we know what we don't know, especially in the Gambian health system. We also didn't want to show up thinking that we have all the solutions without acknowledging the doctors in the Gambia who's been practicing for so long. So the first thing we did was reach out. So we've been reaching out to almost every single doctor that we can. One, to learn about their experiences, understand the challenges, but also find ways of collaborating. So we started a Innovarx Global Doctors Network that not only includes local Gambian doctors, but doctors abroad that we have relationships with, doctors at our super specialty hospital, BLK in India, that we have relationships, to see how we could just broaden the level of access of Gambian patients to these doctors. So it's very collaborative, and I want it to be more collaborative because I think as a health ecosystem, we're stronger together, and that's the beauty of our technology. As you could see with our telemedicine program now, every single doctor could see a patient in here without having to be here.
Physically get into the country.
Absolutely. So
it could be, for example, in the United States and then...
Absolutely, which is the case sometimes. The doctors in the US now could see patients in the Gambia, where we have technology, we have a cloud-based electronic health record system, which all that does is you could be anywhere in the world, you have access to a patient record, so you could confirm diagnosis, you could request more tests to be done. We have the capacity for our nurses to do those tests in-house. So you're basically making the world a smaller place. But now Gambians, their option is not, let me find a visa and go somewhere that's totally foreign and maybe afford to get the treatment. Now the first step could be, well, IGH is here. Let me start there, do a consultation, have access to these international doctors, and only leave the country if you absolutely have to. Which is why the medical tourism aspect of our company is designed for that. We see who really needs to travel for care. But also, if you do travel for care to India, for example, and get a kidney transplant, when you come back, there's already a system in place to make sure now you live longer, make sure your follow-ups are being done. So technology has been fascinating what it's able to do for us, but also I'm excited for what it's doing for Gambians.
And also one thing that, you know, some people would talk about has to do with the quality of the product. There are a lot of, you know, healthcare providers in this country, but sometimes Gambian would complain of the quality of the product.
Absolutely.
All your products, I understand,
Yes.
come from the United States.
Yes, and I think it was important to us to source all our products from the U.S. And I tell people it's nothing specifically special about a product that's sourced from the U.S. The reason is the U.S. does a good job with regulating the quality of products that their consumers have access to. So if you source a product from the U.S., at least you know that you're getting a quality product because they have systems in place that, and this is not a Gambia thing, Africa as a whole, we have a challenge with quality control, with bad actors getting into the healthcare system, selling products that could be counterfeit. So we just sourced it from the U.S. One, because we're a U.S. company, we have access to distribution networks, but also we're getting products that's vetted by the FDA. So its consumers could be rest assured that the quality is from the U.S. So that's one of the biggest reasons why we do take pride that our entire wellness store and our prescription medications are sourced from the U.S. just because we have that quality assurance to it.
And then you are a doctor of pharmacy. Pharmacy is something very critical when it comes to the healthcare. But in this country, there are you know, issues. For example, someone just walking into a pharmacy and then buying a product without going through any diagnosis, for example. You know, so as an expert in pharmacy, that is quite common in this country.
Yes.
As an expert, did you
Yes,
have any
I think
experience?
that's one of the biggest differences that will happen with our structure. Because which is why we laid our store out where the wellness products, yes, has medications. But similar to the US, there's certain medications that they brand over-the-counter medications that you don't need a prescription. So we literally separated the two, meaning we have an over-the-counter section which a pharmacist could still counsel you on how to take a product. But anything that requires a prescription, like an antibiotic, like something for diabetes, hypertension, you cannot walk in and purchase it at our pharmacy.
Without a prescription.
And we're okay with that. Even if it means us losing money, because anywhere else could do it, we think pharmacy exists with pharmacists being gatekeepers of what medications patients have access to from a safety standpoint. So now if somebody just wants to buy an antibiotic, if they don't have a bacterial infection, it actually does more harm to give them the antibiotic. So we built the model to present it in the right way, which is why we have an electronic prescription processing, where now there's accountability built into it. So every single prescription that we process, we have the doctor's information electronically stored. We have the prescription. So what was written, why it was written, how much of it was written. So there's that experience for the patient. But yes, we absolutely believe that certain medications you have to see a trained medical doctor who confirms the diagnosis, and then the dispensing end is monitored by a pharmacist who also makes sure it's the right medication, make sure it's the right dose, make sure it's the right quantity. So that's the model that we're practicing.
That you're practicing.
Absolutely.
Great. So, and then also in this country, you have conventional treatment. You also have traditional ways of going about it when it comes to healthcare.
Yes.
So, you are a doctor, of course.
Yeah.
Do you have anything to share with us in respect of the traditional side of things?
Yeah. So I think you could do both at the same time. I tell people that I am trained in modern medicine in terms of pharmaceutical products. So I could tell you, I could predict what a medication is going to do to your body, how it's going to work, when it's going to work. because we've measured that. So every medication that's pharmaceutically available, studies are done on it. Most of the traditional medicines, I believe that they do work, some of them, and I believe that there's a space for it in a holistic approach of treating a patient, because I don't think modern medicine is the only way. But the challenge is knowing what it actually does when you take it. And also, how do you see how effective it is or how safe it is?
So that's the tricky part there.
That's the tricky part. So I tell people, even if you think taking this herb is good for you, I cannot measure what the herb is doing. But I'm also going to tell you, you need to take your blood pressure medication because it's going to bring your blood pressure down, and I could measure that. So it's always telling people that it's okay to do both, but you have to have systems in place where you could measure how effective something is. So there's a space for both. And I think the Chinese have done a good job with that because they've actually invested in studying their traditional herbs. So they come in with dosage forms, with side effects.
Transforming it, modernizing it.
Absolutely, which is pushing the best of what we have forward, because we have to remember a lot of the modern medicine, they come from natural plants. Like antibiotics come from natural source, a lot of different things. So there's a space for it. We just have to have open dialogue to also make sure we're communicating with patients like, hey, we need to know what exactly you're taking. Don't take this traditional thing and just stop taking your diabetes medication. All right, so there's a space for both.
Basically. Yeah. Do you have any other things to say?
No, just excited. I think the project took us a while to get here for a lot of different factors. I believe that what we have created is the health system we want and the health system we need. With the electronic health record systems, I tell people I'm very passionate about a Gambia that the whole Gambia is linked on one electronic health record system. So we're just hopeful. It's an Africa product. I think it's important that I mention that. Gambia is stop number one. So it's franchise number one in Africa, because our solutions could be solutions for Sierra Leone, for Guinea-Bissau. So we are looking beyond the Gambia as well.
Beyond just the Gambia, but
absolutely.
As well.
But Gambia is near and dear to my heart, so it's a good place to start.
That has to do with your being Gambian?
Absolutely, proudly. And the Gambians deserve a better way forward. And I think even from a competitive standpoint, it'll force competitors to increase the standards, which I tell people competition is good because the people benefit. So if everybody increases their standards, then maybe every pharmacy that you walk into, quality is not a thing you have to worry about. So we're excited, we're hopeful, and just the support is good, so we're very hopeful.
Support is good so far?
Yeah, it has been. I think we trust in the quality of our products and services, and I think that will speak for itself. Any new business, there's challenges that's not unique to us, right? People will tell you this moves slow, there's opportunities left, right, and center, but we have to focus on the Gambian patient, not the Gambian system. If we could improve the lives of Gambian patients, that's where the fulfillment will come. No matter how long, how hard it is, as long as Gambian grandmothers are having access to the same level of care than a grandmother who's in the UK, in the US, that is our goal. That's where our focus is. So definitely that's what we're working towards.
So do you have any experience at all in terms of cost? Like people complaining that, okay, this service is expensive?
Absolutely. I think cost is always a challenge. But I think one of the models that we did was we included the diaspora as part of our business plan. So every single product and service that we have here, somebody in the diaspora could easily go on our website and pay for a loved one to get their kidney function test, pay for their loved one to get their wellness screening. Because we know a lot of Gambians have a lot of support from the diaspora. So the company is sensitive to that. So even though healthcare is expensive across the board, even nations like the US, there's issues with costs. But we have to find creative ways of making it more affordable. And I think the diaspora component of our services makes it a little bit easier for people to have access to it.
Dr. Ismail Badjie, thank you very much.
Thank you. Thank you. Pleasure. Pleasure. Thank you so much.
Thank you.
All right.